Here are the first 20 QA from the text. 1. What are dimorphic fungi? Dimorphic fungi are fungi that exist in two forms, as spores in cold temperatures around 20 RC or 68 ARF, and as yeast in warm and moist conditions, like inside the human body, around 37 AC or 98.6. 2. What diseases are caused by dimorphic fungi? Dimorphic fungi cause several diseases, including coccidioidomycosis, histoplasmosis, cryptococcosis, and blastomycosis. 3. How do dimorphic fungi enter the body? Dimorphic fungi typically enter the body through inhalation of their spores. 4. What are the symptoms of infections caused by dimorphic fungi? Most people infected with dimorphic fungi are asymptomatic, but when symptoms do occur, they are similar to a viral illness, including cough, headache, fever, joint pain, arthralgia, muscle pain, myalgia, and self-limited pneumonia. 5. What is the role of chest X-rays in diagnosing fungal infections? In symptomatic patients, a chest X-ray often shows abnormalities, which can help in diagnosing the infection. 6. Do most cases of fungal infections resolve on their own? Yes, most cases resolve spontaneously without the need for treatment. 7. When do fungal infections become more severe? In a small number of cases, especially in immunocompromised patients, such as those with HIV, the infection may disseminate, spread, to other parts of the body, including the brain, skin, and bones. 8. How are fungal infections diagnosed? Fungal cultures on specialized media are highly sensitive and specific. For cryptococcosis and histoplasmosis, faster diagnostic methods such as antigen detection are often used. 9. How are fungal infections treated? Mild to moderate cases are usually treated with antifungal medications like fluconazole. Severe cases, such as meningitis, require treatment with amphotericin. 10. What is coccidioidomycosis? Coccidioidomycosis, also called valley fever, is caused by a fungus that lives in hot, dry areas such as deserts. 11. What are the common symptoms of coccidioidomycosis? Common symptoms of coccidioidomycosis include joint pain, also known as desert rheumatism, and erythema nodosum, a skin condition. 12. What is the most accurate test for diagnosing coccidioidomycosis? The most accurate diagnostic tests for coccidioidomycosis include sputum culture and serology. 13. How is coccidioidomycosis treated? Moderate disease is treated with fluconazole or itraconazole, while severe disease is treated with amphotericin. Echinocandins, like caspofungin, are not effective. 14. What is histoplasmosis? Histoplasmosis is caused by a fungus that thrives in moist soil containing bird and bat feces, such as in caves or river valleys. 15. How does histoplasmosis present in the body? Histoplasmosis can resemble tuberculosis, with lung cavities similar to those seen in TB. It also affects other organs like the bone marrow, causing pancytopenia, and spleen and lymph nodes. 16. What is the most accurate test for histoplasmosis? The most accurate tests for diagnosing histoplasmosis are culture of sputum, blood, or affected organs, as well as urine and serum antigen tests, which are highly specific. 17. How is histoplasmosis treated? For severe illness, treatment begins with amphotericin followed by oral itraconazole, which is more effective than fluconazole. 18. What is blastomycosis? Blastomycosis is caused by a fungus that lives in soil and rotten wood, particularly near water sources. 19. What are the symptoms of blastomycosis? Blastomycosis primarily affects the lungs, but can also spread to other organs such as bones, skin, and the prostate. 20. How is blastomycosis diagnosed? The definitive diagnosis of blastomycosis is made through a culture of the fungus. There is no antigen test for this disease. Here are the next 20 QA from the text. 21. What is the treatment for blastomycosis? Itraconazole is the main treatment for most cases of blastomycosis. Severe cases may require amphotericin. 22. What is mucormycosis? Zygomycosis. Mucormycosis is a fungal infection that occurs primarily in immunocompromised patients, especially those with diabetes and diabetic ketoacidosis, DKA. 23. How does mucormycosis spread in the body? The infection can spread rapidly, affecting areas such as the nasal passages, eyes, and brain. 24. What makes mucormycosis particularly dangerous? Mucormycosis progresses quickly and has a high mortality rate. Surgical intervention is often required to remove necrotic tissue. Amphotericin is the most effective initial therapy, and posaconazole or isavuconazole may be used for follow-up therapy. 25. What is invasive aspergillosis? Invasive aspergillosis is a fungal infection that occurs primarily in severely immunocompromised patients, such as those with neutropenia or leukemia. 26. How does invasive aspergillosis progress? Invasive aspergillosis progresses rapidly, causing lung infiltrates visible on X-rays or CT scans. 27. What are the diagnostic tests for invasive aspergillosis? The non-invasive tests for invasive aspergillosis include the serum galactomannan assay, VD glucan level, and PCR. If any two of these tests are positive, the specificity for the disease is over 95%. However, a lung biopsy may be needed for a definitive diagnosis. 28. How is invasive aspergillosis treated? The best initial treatment for invasive aspergillosis is with voriconazole, isavuconazole, or caspofungin. Amphotericin is generally not recommended as it is less effective. 29. What is Candida auris? Candida auris is a bloodstream fungal infection that typically occurs in immunocompromised hosts. 30. How is Candida auris diagnosed? Candida auris is usually identified in blood cultures. 31. How is Candida auris treated? Candida auris is resistant to fluconazole and voriconazole, but it is sensitive to echinocandins like caspofungin and micafungin. 32. What is cholera? Cholera is an infection caused by the bacterium Vibrio cholerae that leads to massive watery diarrhea, often described as rice water diarrhea. Vomiting, muscle cramps, sunken eyes, and loose skin, signs of dehydration. 33. What happens if cholera is left untreated? Without treatment, hypokalemia, low potassium levels, and acidosis, an imbalance in the body's pH, can result, leading to a 50% mortality rate. 34. How is cholera treated? The key to treating cholera is hydration to replace lost fluids and electrolytes. Doxycycline can also be used to treat severe cholera infections. 35. What is malaria? Malaria is a mosquito-borne disease caused by the parasite Plasmodium, which infects red blood cells and causes fever, headache, fatigue, and hemolysis, destruction of red blood cells. 36. How is malaria diagnosed? Malaria is diagnosed using a thick smear to detect the presence of the parasite in the blood, and a thin smear to help identify the type of malaria-causing parasite. 37. What is the treatment for mild to moderate malaria? Plasmodium falciparum infection, a more severe form of malaria, is treated with mefloquine or atovaquone, proguanil. Plasmodium vivax or Plasmodium ovale infections are treated with chloroquine or primaquine. 38. What is important to consider before using primaquine? You must test for G6PD deficiency before using primaquine, as it can cause hemolysis in people with this genetic condition. 39. What are the manifestations of severe malaria? Severe malaria is characterized by parasitemia, the presence of parasites in the blood, greater than 5%, CNS abnormalities, hypotension, such shock, pulmonary edema, renal injury, acidosis, or hypoglycemia. 40. How is severe malaria treated? Artemisinin-based therapies, such as artemether or artesunate, are the first-line treatments for severe malaria. IV quinine is less effective. Here are the next 20 QA from the text. 41. What is malaria prophylaxis? Mefloquine or atavaquone proguanil can be used for malaria prevention. Avoid mefloquine in patients with a history of neuropsychiatric illness. 42. What are mosquito-transmitted viral syndromes? Mosquito-transmitted viral syndromes are diseases spread by mosquitoes, such as Zika, dengue, and chikungunya. These viruses are transmitted by Aedes mosquitoes, while Ebola is not transmitted by mosquitoes. 43. How are these mosquito-borne viral diseases diagnosed? Mosquito-borne viral diseases are diagnosed using serology, such as ELISA, enzyme-linked immunosorbent assay, and PCR, polymerase chain reaction. 44. Do these viruses have specific antiviral treatments or vaccines? None of these mosquito-borne viral diseases have a specific antiviral therapy or effective vaccine available. 45. What is chikungunya? Chikungunya is caused by a single-stranded RNA virus of African origin transmitted by mosquitoes. 46. What are the symptoms of chikungunya? Chikungunya is characterized by intense joint pain that may last for months, periarticular edema, swelling around the joints, and a rash, which occurs in less than 50% of cases. 47. How is chikungunya different from dengue? Chikungunya causes joint pain, while dengue causes bone pain. Chikungunya is typically associated with joint pain and swelling, while dengue is associated with more severe bleeding complications. 48. What is dengue? Dengue is another mosquito-borne viral infection caused by the dengue virus. 49. What are the symptoms of dengue? Dengue causes bone pain, not joint pain, severe thrombocytopenia, low platelet count, leading to petechiae and potential GI bleeding, and severe hemorrhage and shock, sometimes leading to death. 50. What should you look for when diagnosing dengue? When diagnosing dengue, look for a low white blood cell count, WBC, and high transaminases, liver enzyme levels. 51. How is dengue treated? Treatment for dengue involves fluids, including blood and platelet transfusions if needed, due to the risk of bleeding. 52. What is Zika? Zika is a mosquito-borne viral disease that has gained attention because of its severe effects during pregnancy. 53. What are the symptoms of Zika? The symptoms of Zika include fever, headache, malaise, and rash in some cases. 54. Why is Zika dangerous in pregnancy? Zika can cause microcephaly, a condition where the baby's head is smaller than normal, leading to developmental issues. 55. What other condition is Zika associated with? Zika is also associated with Guillain-Barré syndrome, a rare condition where the immune system attacks the nervous system. 56. What is Ebola? Ebola is a viral infection that is not transmitted by mosquitoes and is not airborne. 57. How is Ebola transmitted? Ebola is transmitted only through direct contact with body fluids from an infected person who has symptoms. 58. What are the early symptoms of Ebola? The early symptoms of Ebola include a nonspecific viral syndrome, fever, headache, malaise, and severe GI distress, including high-volume diarrhea. 59. What are the lab findings associated with Ebola? Lab findings associated with Ebola include a low white blood cell count, WBC, thrombocytopenia, low platelet count, and increased transaminases, liver enzymes. 60. What happens in the later stages of Ebola? As the Ebola infection progresses, patients can develop encephalitis, brain inflammation, followed by hypovolemic shock and death. Here are the next 20 QA from the text. 61. What is the mortality rate of Ebola? Even with rehydration, the mortality rate of Ebola is very high, around 70%. 62. What is familial Mediterranean fever, FMF? Familial Mediterranean fever, FMF, is a genetic disorder that causes recurrent episodes of abdominal pain, tenderness, and fever. 63. What tests are used to diagnose FMF? Abdominal ultrasound, CT scans, and colonoscopy do not show abnormalities in FMF. Blood tests like ESR, CRP, WBC, and fibrinogen levels are elevated during an attack, indicating inflammation. 64. How is FMF treated? FMF is treated with colchicine, a medication that helps reduce inflammation and prevent future attacks. 65. What is a long-term complication of FMF? A long-term complication of FMF is amyloidosis, where abnormal protein deposits build up in organs, potentially leading to organ damage. 66. How is FMF diagnosed at the genetic level? The MAFE gene supports the diagnosis of FMF, as mutations in this gene are associated with the disease. 67. What is anthrax? Anthrax is an infection caused by the bacterium Bacillus anthracis, which can occur in animals like sheep, cattle, horses, and goats. 68. What are the forms of anthrax that occur in the United States? The three main forms of anthrax in the United States are cutaneous anthrax, gastrointestinal anthrax, and inhalation anthrax. 69. How is anthrax diagnosed? Anthrax is diagnosed through a culture that shows boxcar-shaped encapsulated rods, a characteristic appearance of the Bacillus anthracis bacterium. 70. How is anthrax treated? The treatment for anthrax involves antibiotics such as quinolone or doxycycline. 71. What is babesiosis? Babesiosis is a disease caused by a protozoan parasite called Babesia, transmitted by ticks, that infects red blood cells and causes hemolysis, destruction of red blood cells. 72. Who is at higher risk for babesiosis? Asplenic patients, those who have had their spleen removed, are at a higher risk of severe, life-threatening complications from babesiosis. 73. How is babesiosis diagnosed? Babesiosis is diagnosed using a blood smear showing red blood cell inclusions, parasites inside the cells, and the most accurate test, PCR, polymerase chain reaction. 74. How is babesiosis treated? The treatment for babesiosis includes azithromycin combined with atovaquone. 75. What is Bartonellosis? Bartonellosis is an infection caused by the bacterium Bartonella, which can lead to different diseases depending on the type of Bartonella involved. 76. What is cat scratch disease? Cat scratch disease is caused by Bartonella hinselae and is characterized by enlarged and tender regional lymph nodes near the scratch or bite site of an infected cat. 77. How is cat scratch disease diagnosed? The diagnosis of cat scratch disease is mostly clinical, based on the patient's symptoms and history of cat exposure, often supported by serology, blood tests to detect antibodies. 78. How is cat scratch disease treated? In most cases, no treatment is needed for cat scratch disease, but azithromycin can speed up the resolution of symptoms. For patients with complications, treatment with doxycycline or azithromycin and rifampin is recommended. Here are the next 20 QA from the text. 79. What is Bartonella endocarditis? Bartonella endocarditis is an infection of the heart's inner lining caused by Bartonella quintana. It is more common in people who are homeless or have had flea bites. 80. How is Bartonella endocarditis diagnosed? Bartonella endocarditis is diagnosed through serology, blood tests, and PCR, which detects the DNA of the bacteria. 81. How is Bartonella endocarditis treated? Ceftriaxone, doxycycline, and gentamicin are used initially until Bartonella is confirmed. After confirmation, the treatment is usually doxycycline and gentamicin. 82. What is brucellosis? Brucellosis is an infection caused by the bacterium Brucella, often contracted from exposure to unpasteurized milk or uninspected meat. 83. What are the symptoms of brucellosis? Brucellosis can present with fever lasting weeks or months, hepatosplenomegaly, enlarged liver and spleen, endocarditis, infection of the heart lining, osteomyelitis, bone infection, meningitis, inflammation of the brain and spinal cord, and chronic joint pain. 84. Who is at higher risk for brucellosis? People from outside the United States who have been exposed to infected animals, people who have consumed unpasteurized milk or uninspected meat, and returning war veterans who may have been exposed to brucella during their service. 85. How is brucellosis diagnosed? Brucellosis is diagnosed by culturing the brucella bacteria from blood, CSF, urine, or bone marrow. 86. How is brucellosis treated? Brucellosis is treated with doxycycline and gentamicin. For bone and heart infections, rifampin is added to the regimen. 87. What is echinococcosis? Echinococcosis is an infection caused by the Echinococcus parasite, which is typically found in dogs and sheep. 88. How is echinococcosis transmitted to humans? Humans can get echinococcosis by ingesting Echinococcus eggs that are shed in the feces of infected dogs and sheep. 89. Where does echinococcosis spread in the body? The Echinococcus parasite spreads to organs such as the liver, lungs, and sometimes the brain, forming hydatid cysts. 90. How is echinococcosis diagnosed? Echinococcosis is diagnosed using sonogram, CT scan, or MRI to detect the presence of hydatid cysts, and ELISA, a blood test, to confirm the diagnosis. 91. How is echinococcosis treated? Echinococcosis is treated with oral albendazole, a medication that kills the parasite. Injecting alcohol into the cysts can also help treat the infection by destroying the cysts. Aspiration of the cysts is avoided as it could spread the infection. 92. What is ehrlichiosis and anaplasmosis? Ehrlichiosis, monocytic, and anaplasmosis, granulocytic, are diseases caused by obligate intracellular parasites similar to the bacteria Rickettsia. 93. How are ehrlichiosis and anaplasmosis transmitted? Ehrlichiosis and anaplasmosis are transmitted through the bite of the Ixodes scapularis tick, which is the same tick that spreads Lyme disease and babesia. 94. What are the symptoms of ehrlichiosis and anaplasmosis? The typical symptoms of ehrlichiosis and anaplasmosis include fever, headache, malaise, general feeling of discomfort, and chills. A rash is uncommon in these infections. 95. What blood test findings are expected in ehrlichiosis and anaplasmosis? In ehrlichiosis and anaplasmosis, blood tests typically show a low white blood cell count, WBC, low platelets, and high transaminases, AST, ALT, which are liver enzymes. Here are the next 20 QA from the text. 96. How is ehrlichiosis and anaplasmosis diagnosed? The most accurate test for diagnosing ehrlichiosis and anaplasmosis is serology, which detects the bacteria and shows morally clusters of bacteria inside white blood cells. 97. How is ehrlichiosis and anaplasmosis treated? The treatment for ehrlichiosis and anaplasmosis is with the antibiotic doxycycline. 98. What is leptospirosis? Leptospirosis is an infection caused by the Leptospira bacteria. 99. How is leptospirosis transmitted? Leptospirosis is most commonly transmitted by the ingestion of food contaminated with the urine of infected animals, often rats. 100. What organs does leptospirosis affect? Leptospirosis affects the kidneys, causing oliguria or reduced urine output, liver, and potentially the central nervous system, CNS. 101. What symptoms are seen in leptospirosis? Symptoms of leptospirosis include muscle pain, elevated CK, creatine kinase, an enzyme released during muscle injury. 102. What reaction does leptospirosis cause in the body? Leptospirosis can cause a Jerisch-Herxheimer reaction, where the body reacts to the bacteria dying, causing a temporary worsening of symptoms. 103. How is leptospirosis diagnosed? Leptospirosis is diagnosed using serology tests like ELISA, which detects antibodies against the bacteria. 104. How is leptospirosis treated? Leptospirosis is treated with antibiotics like penicillin, such as amoxicillin, ceftriaxone, or doxycycline. 105. What is leishmaniasis? Leishmaniasis is an infection caused by the Leishmania protozoan, a type of parasite, spread by sandflies. 106. What are the two forms of leishmaniasis? The two forms of leishmaniasis are skin mucosal leishmaniasis, which affects the skin or mucosal areas, and visceral leishmaniasis, which involves internal organs like the liver and spleen and causes fever. 107. How is leishmaniasis diagnosed? Leishmaniasis is diagnosed by direct visualization of the parasite in aspirates, fluid samples, from the liver, spleen, or bone marrow, as well as through PCR, polymerase chain reaction, and culture. 108. How is leishmaniasis treated? Leishmaniasis is treated with liposomal amphotericin, miltefosine, and antimonials, like stibogluconate. Miltefosine is specifically used for cutaneous, mucosal, and visceral leishmaniasis. 109. What is plague? Plague is a serious infection caused by the bacterium Yersinia pestis. 110. What are the symptoms of plague? Plague typically presents with sudden onset high fever, intense headache, severe muscle pain, myalgia, and in the bubonic form, enlarged lymph nodes, buboes. In the pneumonic form, the infection affects the lungs and can be fatal within 24 hours. 111. How is plague diagnosed? Plague is diagnosed by a smear of lymph node aspirate, showing gram-negative rods, the appearance of Yersinia pestis bacteria, and the most accurate test, which is culture of the bacteria. 112. How is plague treated? Plague is treated with streptomycin, gentamicin, or doxycycline antibiotics. Here are the next 20 QA from the text. 113. What is tularemia? Tularemia is an infection caused by the bacterium Francisella tularensis. 114. How is tularemia transmitted? Tularemia can be transmitted through contact with infected animals like rabbits, muskrats, and prairie dogs, or through bites from ticks or flies. 115. What are the symptoms of tularemia? Tularemia can cause skin ulcers, glandular enlargement, swelling of lymph nodes, and conjunctivitis, inflammation of the eye from a tick bite. Inhalation of spores, bioterrorism, can lead to rapidly fatal pneumonia. 116. How is tularemia diagnosed? Tularemia is usually diagnosed through serology to detect the body's immune response to the bacteria, as culture of the bacteria is dangerous due to the risk of releasing dangerous spores. 117. How is tularemia treated? Tularemia is treated with streptomycin, gentamicin, or doxycycline antibiotics. 118. What is the role of chest X-rays in diagnosing fungal infections? In symptomatic patients, a chest X-ray often shows abnormalities, which can help in diagnosing the infection. 119. Do most cases of fungal infections resolve on their own? Yes, most cases of fungal infections resolve spontaneously without the need for treatment. 120. When do fungal infections become more severe? In a small number of cases, especially in immunocompromised patients, such as those with HIV, the infection may disseminate, spread, to other parts of the body, including the brain, skin, and bones.